coalition team of United States and Australian medical specialists are saving lives every day in Uruzgan province, Afghanistan. 39 personnel from the US Navy, US Air Force, Australian Army and Royal Australian Air Force are working together to provide medical care to military and civilian casualties, including coalition and Afghan soldiers, policemen, local residents and insurgents wounded in battle. In late February, Tarin Kowt Role 2 hospital staff performed life-saving treatment on an Afghan National Army soldier who sustained extreme facial injuries from an insurgent-laid improvised explosive device.
In this patient's case, there was a major laceration in the lower jaw and apparent or possible fracture of the jaw. Approximately within 45 minutes from the time of arrival, the patient was then taken to the operating room, where they were intubated with a tube put down the throat in order to control breathing. And then the wounds were irrigated, inspected manually, and the foreign body, which was a bullet, was removed.
The patient was then taken from the operating room to the intensive care unit for stabilisation and subsequent aeromedical evacuation to the Afghan government-operated Kandahar Regional Medical Hospital.
So they would be transferred to KRMH for care by the Afghan physicians. This particular patient should have 100% survivable and end up with a normal jaw.
The mortality rate of casualties is highest from the time of injury to the time of medical evacuation, but if a casualty is brought to the Role 2, their chance of survival is 98%.
Yeah, so essentially what we do is whenever a patient comes in, we have a systematic approach that we go through to try and locate any injuries to the patients that are going to be the most likely things to kill them quickly and to intervene in those processes and try and stop it.
The purpose of the Role 2 is to receive, stabilise and control major injuries before preparation and transportation to tertiary medical facilities. The Role 2 team includes surgeons, medics, pathologists, nursing officers, physiotherapists and X-ray specialists.
The patient came into the trauma bay, and with any trauma they always need some sort of pathology, so we got our bloods. We did blood typing in case the guy needed a transfusion. We did some blood gases. We did some just basic coagulation pathology. All the results just helped the doctor in the management of the patient.
This is Captain Jesse Platts for Combined Team Uruzgan.